Look, most of us are relating to pain significantly in a major way. And we have all sorts of pain. We have emotional pain, we have physical pain. And it's really an opportunity for us to notice moment to moment. Our pain needs to be considered we got to learn how to dance with the pain, because we develop a relationship between pain and suffering. Pain is inevitable, but suffering is optional. So Tara Brach actually talks about pain times resistance is in actual fact suffering. So, as long as we're resisting that pain, we will suffer with pain. So we've got to watch ourselves and learn to make ourselves comfortable with that pain. So perhaps what I'm going to be doing in this session is really give you an idea of, we'll go through some questions that Peter had asked about, like, what is pain? So let's go through what exactly is pain. Pain is actually, we all know that it's a really unpleasant feeling. It causes pain. There's a critical component of the body's defense mechanism, defense system, and that's the level of pain that actually results in suffering. So the pain is in actual fact a warning that relays, that instructs our motor neurons of the central nervous system to actually minimize and detect that pain. So there's mainly three types of pain all of us experience, and particularly with chronic fatigue, with fibromyalgia, with autoimmune type diseases, we experience long-term pain, and this is a chronic pain. So acute pain is really short, sharp, sweet. Okay, it's short, it's followed by, it's usually centralized in one area. So acute pain could be something like childbirth, for example, whereas chronic pain lasts long time. It's about people have them for months and months and months. So when a person complains of pain, what they're seeing is a central sensory sensitivity. And there's a huge problem out there. Firstly, we come from a mentality of pain, pop a pill, right? So there's this overuse and the misuse of medication that reached critical levels. So when we put the pain under the microscope, we really see that the mind searches for these patterns and these clues to bring the mind, or the memories rather, of when they felt that pain and how it relates. And so how do we amplify that pain in the present? So Buddha actually says, pain is inevitable, but suffering is optional. So, where do we feel the pain? We feel the pain in the brain. So why? Because the nociceptors are actually found in the brain. These are our receptors. They are our endocannabinoid receptors. They're actually found in the brain. So, the other day I went to, before COVID, we went to a dinner together. And with our age particularly, we find that the conversations always revolve around pain. Oh, it's like an organ recital, really. Oh, this is sore, my neck is sore, that is sore, etc. And, knees are sore, hips are sore. So this becomes part of a conversation in chronic inflammation, in chronic inflammatory diseases. And then one person says, bloody hell, we should all be grateful. We all got in a car and we drove here. So that's fantastic. So it's a matter of changing our, changing the story, because we have this worry story in ourselves, and like, what's next? What are the pathways for the worst scene? And we need to move our attention away from obsessing on how to fix it, or should we blame somebody else for the pain, or whose fault do we get victimized with this pain? And often pain is such a huge issue in the body, and the body fights it by drawing all the nutrients to ward off that pain. Okay, so we automatically tense, we have chronic apprehension, we push away, it's constant pushing away. So when we identify from this defended self we get small, we become separate. So the wisdom in the opportunity to consider pain is to actually awaken our attention. Pain becomes really a portal. It's a messenger for the cell. Instead of tightening and separating ourselves, to actually open it, acknowledge the pain, feel it, don't resist it, stay, heal is a typical saying with pain, because this is what, when a midwife takes a woman who's undergoing giving birth, that's acute pain, and the way they get their women to start changing that pain is to accept it, to notice it, to notice the texture, the density, or the frequency of the pain contractions, and allow the pain to flow. So that's the strategy. These are all these fixations and pain. It's like when you chip your tooth, for example. How many times would your tongue would automatically go to that chipped tooth, and so we become fixated. So this change. Rumi actually says the cure for pain is actually in the pain. So bringing, we need to pendulate. This is part of psychotherapy, pendulating, feeling the space and the sensation. When it's like, instead of being the ocean, we need to feel the waves as part of the ocean. The waves are us as part of the ocean. But let's move away from considering pain as most of us experience and know how to manage it from a mental perspective. But perhaps we might need to look into, how bad is it out there in terms of pain? Actually, 1 in 5 of us Australians have some form of chronic pain. And that's a lot. Women tend to have more pain than men, and the prevalence of that chronic pain in Australians is estimated to double in 2050. So look, there are so many, 150 hospitalizations occur daily in Australia due to opioid misuse. And there are, 14 emergency department presentations per day involving opioid harm. So we know that pharmaceuticals have limitations. We know that pharmaceuticals are valuable, especially our opioids, but we need to know what else is there. There's 62% of all drug-induced deaths are associated with opioid use. Okay, so let's have a look at the next question is, what are the different types of pain that we actually have? We need to really see, everybody experiences some sort of pain. They might have a trauma, for example. So we look for this hook to hang things on. Is that going to be a conversation piece at a dinner party, for example? So the key is really to unhook it. Is the pain a revisiting sensation, and how do we unhook it? We know that talk therapy, mind medicine is very, very important. So let's discuss the types of pain, and then we'll go through what are the pharmaceutical options, and more importantly, what are the newer natural options that are available. So the types of pain that we can actually experience is really based on where these nociceptors or the pain detecting neurons are. So somatic pain, that comes from ligaments, tendons, bones. It's usually a dull, localized pain. Whereas visceral pain is usually associated with the body organ, for example, like internal cavities, where they might have a little bit of referred pain. Neuropathic pain is where most of us feel pain, and that is nerve. It's a neuralgia. It's an injury or a disease to the nervous tissue that disrupts the ability of the sensory nerves to actually transmit that correct information. So the primary pain is usually damage to the body, the central nervous system, and it's unfiltered information from the body to the brain. Okay, whereas secondary pain, this is a reaction to the unfiltered information. It's controlled by an amplifier in the brain that dials the pain up or dials it down. That's the intensity of the pain, and that's what we call suffering. So what are the factors that will actually increase it? Sometimes you might have a limb amputation. Cancer pain is excruciating, okay? Physical damage, you may have broken a bone, but aging can be painful. Surgery can be painful. Depression can be painful. So neurotransmission pathways, these are neurotransmitters, affect the endocannabinoids. These are also neurotransmitters, okay? And there's so many variables, like, I mean, you know, you could have the variables that influence pain could be attention. So are you distracted, okay, from the pain? Is there a psychological state? Anxiety. Anxiety will enhance pain perception. Or a lot of us are sleep deprived. So, and also the other thing is gender. Some men, women can perceive pain better than men can perceive pain, or others block them better. Or there might be social or cultural norms. So some cultures, men are actually discouraged from experiencing pain or even expressing that pain. So that's a natural event. So in terms of measuring pain, we know that we can measure it through markers in our bloods like ESR, which is erythrocyte sedimentation rate, or your ferritins, your CRP. We can have a look at cytokines, which are basically your inflammatory markers, your Th1, Th2 pathways. We can have a look at omega oils because they play a role in the inflammation process. There are many questionnaires, etc. So, but we also need to say, okay, we know we've got pain. What's causing that pain? Is that due to perhaps a heavy metal toxicity, for example? You know, you may have been working with asbestos for all your life. So, and suddenly you have pain in the lungs. You might be a patient who has, or you might have been a miner or a dentist who has had exposure to heaps of heavy metal toxicities. So we need to consider the underlying cause of the pains. Some, most autoimmune patients may have had exposure to mold or Lyme or biotoxin exposure. So that in itself causes pain. So there's so many options available, but we need to, when working with a practitioner, we need to actually go and have a look at the underlying issues. You might even have an antibody associated dysfunction. For example, an autoimmune disease like MND or MS, where muscles start to break down. These are also patients that experience pain. So there's a device called a dolorometer, which is an instrument used to measure pain. And but really what you're measuring is a danger detection system, and that's called nociception. Okay, these danger detectors are spread throughout all the tissues in the bodies, and we decide whether you actually need to be protected, or you know what triggers the pain and what protects you from the pain. So there are many options available in terms of treatment. Of course, pharmaceutical medicines, these are painful pills to swallow, but at the same time, they are very valuable. Paracetamol, aspirin. The problem with paracetamol is within pharmacy, I can see so many people suffering with severe liver dysfunction, severe indigestion. They're on so much proton pump inhibitors because their bodies just cannot tolerate that high level of paracetamol use. We are now using paracetamol Osteo, which is close to 665 milligrams per tablet, 2-4 times a day. And that's huge. The liver just can't cope with it. So, and salicylic acid, which is the traditional aspirin, we're moving away from it instead of moving towards that. And again, it has a problem with gastrointestinal ulcerations. Of course, we've used your opiates, your lidocaines and procaine injections. We know that Michael Jackson died of anesthetic injections and was used for pain at the time and to get him to sleep better. And this here is, you know, anesthetics has its limitations, but should not be used routinely. Your non-steroidal anti-inflammatories have moved from the standard ibuprofens and the feldines and the naproxens of the world, and it's moved on to the newer generation of those non-steroidals. So we're using meloxicam and we're using Celebrex, etc. So it works for some and it doesn't work for some. Of course, we have all the opioids, ranging from codeine over the counter, all the way, it's no longer over the counter, all the way through to your oxycodone, MS-Contin, your fentanyl patches, etc. And they are needed. There is a place for these opioid type supports. However, as a result of codeine being scheduled, the prescriptions on endone has shot sky high. Okay, so we're fighting the battle with our opioid prescription use. Of course, we can also use anti-epileptics such as your gabapentin, your Lyrica, etc., for some of the neuropathic pain. And then antidepressants like SSRIs are also used for pain management. Okay, so there are a whole host of pharmaceuticals that can be very useful. So now let's look at what can we do if these pharmaceuticals are no good for us? What are our options? So the options that are available in terms of natural treatments are things like willow bark. 400 BC, Hippocrates has been documented as being recommending the bark of the willow tree. To chew on that for pain relief. So that's really handy to know that, you know, we get our aspirin from this particular tree. So the important thing is that salicin, which is a component of aspirin, it's actually converted to salicylic acid by the liver, and it's considered to have less side effects than aspirin. There's a number of studies, and I will probably, in the information that I'll send you, I'll quote the studies so that you have access to them. They had 451 patients who had back pain. They suffered with back pain, and 40% were of these patients were pain-free just using the white willow bark. It's a standardized dose of 240 milligrams of this herb. There are other herbs that have been shown to be really good. Now, the way these herbs work is they work on the same pathways as your non-steroidal anti-inflammatories. So they inhibit COX-1 and COX-2. These are the inflammatory prostaglandins in our body. So they dampen down and they inhibit these pathways that cause inflammation. Another great herb is boswellia. Now, boswellia has actually been studied fairly extensively and has been compared to non-steroidal anti-inflammatories. So boswellia, in actual fact, is called frankincense. It's derived from an Ayurvedic herb, so it's based in an Indian herb. It actually inhibits these inflammatory processes by the 5 LOX and COX pathways. So these are the same pathways as your non-steroidal anti-inflammatories work. So pain scores were reduced by 65% in some of these studies. Curcumin is another one. So curcumin is now known as also turmeric, it's derived from turmeric. It suppresses NF-kappa B, which is your nuclear factor kappa B. This is an inflammation pathway. And it reduces the interleukins, the same interleukins by which your essential fatty acids work as well. These are your good oils, right? Things like herbs such as ginger, ginger is really stimulating, but can also be very useful. Magnesium is very, very important. It's a nerve food. It's a muscle food. So magnesium, there's plenty of studies on magnesium. And this is why we soak our body in Epsom salts. This is why we use magnesium gels to rub onto the particular area. A number of studies being done on it. The frequency in migraine patients, for example, they found that there was a 41% reduction in migraine pain with using magnesium. Most of us are familiar with magnesium. We're all deficient in magnesium. We actually need 20 molecules of magnesium in the Krebs cycle to produce 1 molecule of ATP. So see how important ATP is. Our energy molecule, so that's the stuff that gives us energy. Magnesium is so, so important. And we tend to be deficient in it, over periods of time. Now, the herbs can actually be divided into anodynes, which are basically your painkillers, your anti-inflammatories, and then spasmolytics. Spasmolytics are agents that actually reduce the spasming of your muscles, okay? So some of the herbs that are really valuable that are now being popularized are things like Californian poppy, Jamaican dogwood, lion's mane, rosehip, valerian, willow, wood betony. Feverfew is great if there's pain. Crankbark is another one particularly useful in menstrual periods as well. So a good herbalist would be able to take into consideration the anodynes, the anti-inflammatories, and the spasmolytics, and put those herbs together and compound it individually for you. So that's something that's worth knowing about. One of the herbs that is actually really worth chatting about is Corydalis. Corydalis is a really effective analgesic. It's a phytomedicine. It comes from the traditional Chinese, so it's a TCM herb. And it is used, it's not only analgesic, but it also has mild sedating activities. So a lot of us have problems with sleep and pain. We can't shift this way because that hurts, or can't shift this way, it hurts. And so we need to be aware of it. So Corydalis works by acting on the monoamine oxidase neurotransmitters like dopamine, noradrenaline, and serotonin. So that's really important when you can get a herb that works on those neurotransmitters that cause us depression and anxiety, etc. And another herb that's worth making mention of is Californian poppy. Californian poppy is also traditionally used to give you a good restful sleep. This is used in Western medicine. It's non-habit forming, and it works on the basis of it binding to GABA receptors to activate the GABAergic system. And we know we need good GABA, a decent amount of GABA to actually calm the nervous system down, okay? And it also induces a deeper sleep. Now, often a doctor won't tell you this, but a naturopath might tell you that as long as you're acidic, you're going to aggravate pain. So what does that mean? A lot of us, when you're stressed, you tend to be really acidic. Of course, eating, meat, red wine, pineapples, tomatoes, eating all the acidic foods, they can also aggravate acidity. By alkalinizing the system, we'll help with conditions such as gout and swelling and inflammation. But by alkalinizing the system, you're also reducing those uric acid crystals developing, but more importantly, it actually helps with pain, the episodic pain as well. So keeping the system as alkaline, this is why diet plays such a great role, and we'll talk about diet in a minute. There's another herb called sour cherry, and these are available in a lot of your Chinese shops, for example. They actually have found that the plasma urate levels after this sour cherry consumption actually reduced periods of pain intensity by 35%. And this is a study done on 633 participants who had gout attacks, and they found a 35% reduction just on sour cherries. So there is a lot of work being done and studies published on these various herbs. Celery seed is another one. Do you know what? I actually recommend a little recipe, and I'm happy to share that with the group. It's a recipe that contains celery seeds, sesame, turmeric, ginger, a bit of bone broth, a combination of all these spices that would be used, and you just bar mix the whole lot with some coconut oil, bar mix it, pop it in a jar and keep in the fridge. And each day you would use a spoonful. So it's got gelatin in it. So people who have osteoarthritis, what you're doing is you're repairing that cartilaginous mass with gelatin. The celery seed is anti-inflammatory. There's a number, I'll share that recipe with you. There's a few other recipes that are worth looking into as well. And that's really useful when, instead of buying really expensive supplements, you can make your own pain remedy at home. But things like potassium, which has alkalizing effects, or vitamin C has also been known to be a benefit, particularly patients with gout. Of course, movement is so, so important. If we don't move it, the problem is, if you're in pain, you can't move because it's so sore. So it's important to be able to do some stretching exercise or some chair exercises if you can't go out and walk. Doing a movement in a pool, for example, where your body weight or your body mass is not on the joints, that might be of use as well. But it's a matter of regularity in terms of movement. So it's very important to do stretching and exercises that is conducive to your body. Of course, gentle exercises like energy repleting rather than energy depleting exercises. So yoga, tai chi, biking, walking, aerobics, etc. Everybody's in a different state. One size does not fit all. So it's a good idea to actually work with your exercise physiologist or chiropractor or physiotherapist to work out which exercises. But it is important to make sure that they are part and parcel of your day-to-day life. You can also, of course, use baths that contain Epsom salts with orange, geranium, and bergamot, and there's a whole bunch of really great essential oils. Unfortunately, most people who are suffering with pain cannot even get into a bath, let alone get out of a bath. So we need to be mindful of that. So using those oils as a rub would be very useful. So now what I'd like to talk to you about is what is actually new in the whole arena. Of course, diet plays a major role. We need to remove any allergens that we know of, and especially look at removing the inflammatory foods in our body. So what's inflammatory? It's sugar, it's refined, processed foods, particularly saturated fats. We need the good oils, but the saturated fats tend to be, especially things that are fried and prepared, like frozen things, frozen chips, for example. They're full of saturated fats. Too much of alcohol or caffeine, all of those things are inflammatory in the body. So, we won't be talking too much about diet, but really we need to think about those things. A lovely little recipe to help with, like an ice cream as an example, would be something like using frozen bananas and add your turmeric and ginger and cardamom and cinnamon and cloves and black pepper and put all of those spices in. Bar mix the whole lot and freeze them. And that could be your own version. You can drizzle some honey over it, and that would be your version of a anti-inflammatory dessert for yourself. So I'm happy to share all of those with you. Look, there are a number of devices that one can use. Some of the devices are laser therapies, they're implantation devices, they're pulse transmitter patches that you can wear. They are photobiomodulation devices. They're TENS, like your transcutaneous electrical nerve stimulus, so it releases a nerve impulse, which sends your basically neural pulses to the brain. They are opioid-sparing elastometric infusion pumps that are available, so that delivers a regular small flow of local anesthetic. This is a device that's implanted. Cooled radio frequency, they deactivate that pain-causing sensory nerve stimulation. Low-level laser is very popular, or cold laser therapy is very popular. Some of the low-level lasers use light therapy or light energy to stimulate the cells. It's interesting, whilst I was researching some of the options that are available, what tends to be, seems to be a lot more popular, or more people are becoming more aware of it, is immersion experiences. So like virtual reality, maybe it could be a helicopter flying over, you know, some rugged Iceland, for example, or music or sound or smells or lights, different colors. These are all the various options that are available in terms of management of pain, and has been well studied and effective in a lot of cases. Another technique is called spinal flow technique, and that facilitates basically the rewiring of the brain, and your body relearns what is already new to begin with, you know, basically how to self-heal. Then there are things like your nerve root blocks and the epidural steroid injections as well. So that can be used particularly with herniated discs or disc problems. And then there are other modalities that are available, such as manipulative muscle therapy, which involves the therapist using their hands to manipulate the muscles. Okay. So of course, you know, mind-body medicine helps. People go through so much pain just trying to avoid pain. And so a positive mindset and motivation is very, very important to get through these tough times. Now let's discuss some of the newer therapies that are available. One of the newer therapies that I'd like to make mention today is your specialized pro-resolving mediators. These are, in actual fact, lipid mediators. They're fat mediators that occur naturally in the body. They are actually made in the intestinal mucosa, and they work at assisting with tissue repair, with healing, with recovery. It actually recruits immune cells and inflammatory mediators to relieve pain. So it repairs the damage and the clearance of pathogens. So it is, in actual fact, these specialized pro-resolving mediators, they omega-3, 6s, and 9s, your EPA, DHA, these are your fish oils. They are precursors of these specialized pro-resolving mediators, and they don't possess the same properties. So if you're taking fish oils, it won't have the same property as your SPMs. So that's one that has been shown in the literature to be very effective, not only for immune support, but also for inflammation. So that's something that's worth looking into. Another pathway is PEA, which is palmitoyl ethanolamide. Now, PEA is in actual fact an SPM, okay? So PEA can actually be synthesized from a molecule called anandamide, which is one of our own endocannabinoids. So we have our own built-in endocannabinoids. So PEA is one of them. Okay. PEA actually increases the use of the anandamide in the body, and these are your pro-resolving or pro-homeostatic compounds, or pro-resolvent. So they're actually resolving what's been happening in the body and turning it off, turning it on, as opposed to necessarily ending up taking too much of it. and ramping something up or ramping something down. Now, another relative of PEA is OEA, which is oleo ethanolamide. And this is, you see a lot of it in the intestinal mucosa. It's not available as a raw material in Australia. It is available overseas. It's still being studied. So PEA is being available. It basically works on a receptor called a TRPV1, TRPV1 receptor. And that receptor is in actual fact what we call it's also termed as a capsaicin receptor. So it's like, it's the role of the heat. There's a receptor that's involved in the sensation of having, let's say, chili, okay, or capsaicin. It's a role of heat and pain, which is kind of how we describe inflammation in general. It's heat and pain, okay? So, you know, you're either sensitive to it or you're desensitized from it. So, you know, PEA and OEA work particularly on this particular capsaicin receptor. So it's kind of obvious when you get nerve pain and you can feel that heat, okay? The other thing that is also worth looking into is, you know, the PEA works at turning down that mast cell activation. So what does it mean to have mast cell activation? We eat something, we have, it gets into the bloodstream, our white cells become inflamed, they release histamine, these mast cells become, they become fatter, they become inflamed, they activate. So we then develop a food allergy, for example. So what we're wanting to do is with PEA, we want to turn down those main inflammatory mediators. So when we're turning down that sensation of pain. OEA, on the other hand, is there's been a couple of studies being used as OEA where it's increased the abundance even of akkermansia in people with obesity. So this is a very important microbe in the gut. Another avenue that is worth talking about is melatonin. Now, melatonin plus or minus gabapentin with lower back pain has been shown in studies in 2018 to be very beneficial, with the combination of GABA support as well as melatonin together has been used to be very beneficial, particularly prior to surgery. So there's some studies on it. The other great molecule that we make ourselves, it's called oxytocin. Oxytocin has been used more and more lately. It's what we call the cuddle hormone. It gives us a feeling of safety and satisfaction. Oxytocin has also had capacity to turn that pain off. So it's used as a nasal spray and it's used as pain relief as well. Low-dose naltrexone. Naltrexone is used traditionally to break the addictions from alcohol, break the cycle of the opioids. So if you're a opioid addict, naltrexone would be used as an antagonist, you know, to effectively block those receptors of that opioid receptor around the body. So in order really to stop those drugs that people are taking, often illicit drugs or even prescription drugs, so the effect thereof. So low dose naltrexone has been very useful. So if you're on oxycodone and you really want to get off it, you take some naltrexone. Or if you're an alcoholic and you want to break that alcoholic intake, then naltrexone actually blocks those effects of those drugs. That is used traditionally as an antagonist, but we now know that low dose of naltrexone used long term has been very beneficial. The other component is it works on cell signaling systems and basically your endocannabinoid system. Another thing that is worth knowing about, and everybody knows about it, and this is your cannabinoids. So hemp seed oil is one, your CBD, THC. the combination, there's a lot of it because it's all available now, right? And it can be available illegally or it can be available legally. Now, when it's available legally through our medical systems, they are available either as CBD on its own, THC on its own, or combinations of them. CBD oil has been used as a painkiller without giving you that feeling of high. Okay, you don't get that euphoric state with CBD. THC is more addictive. It's tetrahydrocannabinol. It's a different type of cannabinoid. Okay, so what is available commercially today is the combination of them and different proportions of it as well. Okay, so CBD is really great. The other one that is worth making mention of is nitric oxide. So nitric oxide, arginine, is an amino acid that stimulates nitric oxide, just as an example. And what they do is they actually stimulating nitric oxide is used during labor. It's a compound that is derived, it basically stimulates a peptide called TACP4 that affects nerve changes and perception of pain. So nitric oxide is another option. We mentioned oxytocin. Oxytocin is not only used as, it's secondarily had been used as an analgesic, but it was originally used as an more mood stabilizer. So it gives you that feeling of safety. And, you know, mums have very high levels of oxytocin when they just give birth. And this is that nurturing effect with the baby. It's that beautiful high when you're actually holding your baby. So that is, oxytocin's now been shown to have multifunctional analgesic properties with great unique therapeutic properties. They are analgesics. Oxytocin is an analgesic. It's an anxiolytic, so it helps with anxiety, and an antidepressant. So this is what your body makes. It's fantastic. So we now have capacity to do that. There are some patients who tend to use a lot of ketamine. Now, as a pharmacist, I used to make up a neuropathic pain topical application, which contained alpha agonists like clonidine, ketamine, gabapentin, some of the antihistamines, put them all together, apply topically to the actual pain nodes. Today, we know that ketamine, high doses of ketamine can actually temporarily switch off the brain. It disrupts that network between the different regions of the brain. And this could be very useful in terms of pain management. So, you know, what we need to be mindful of is really pain. There are so many options available. There are other things like DL-phenylalanine, which is a amino acid. Phenylalanine is amino acid. So L-phenylalanine is used as a precursor to tyrosine and dopamine, etc. It makes your thyroid hormones, it also makes dopamine. But DL version of phenylalanine has been used very effectively for pain management. So, you know, combining something like your DL phenylalanine together with GABA, together with melatonin, together with magnesium, together with PEA, and a combination of herbs like cordialis, Jamaican dogwood, Californian poppy, a combination of those two strategies would be ideal in terms of supporting and helping pain from a naturopathic perspective or from a natural, perspective. So really, in closing, what I'd like to say is that, through love, all pain will turn to medicine. It's changing the way we think. The cure of the pain is actually in the pain. It's very easy for somebody who's not experiencing pain to actually mention this to others that are experiencing pain. But it's a management of how we can perceive that pain is so, so important. So, you know, we need to have that the wisdom to be able to intelligently look into pain with love and presence. Allow the pain and allow the energies to flow.